All right. Welcome to those of you that are here today. Looks like we have a couple folks. These are our Q&As with me. We do every board meeting night at 5:30. Appreciate those of you that come and then share the information with others. We're at least doing them through the end of this year. So next one will be at 5:30 before our April board meeting. First off, just want to share a few good news things. We have hired our district nurse. So for the most of this year, we were contracting with an individual, Miss Sarah Elliott. We've had our permanent job posted. We finally twisted her arm enough to apply for the job, and she'll be starting at 3/4 time right after spring break. So she will be in our buildings she'll work about a 6-hour day. Well, she can go to any building at any time. She'll essentially be assigned 1 day of the week at each building. So for example, Mondays, this is just an example, but Monday she's at Veneta Elementary, Tuesday Elmira, Wednesday the middle school, Thursday the high school, and then maybe Friday floating is needed. And I actually think what we talked about was making the 4 days Monday, Tuesday, Thursday, Friday, and then Wednesday our shortened day if there's no school on Friday or Monday when one of those schools are in normal time, jumping in there on Wednesday. So we're excited to have her. She's done a great job this school year, and going forward it'll be great to have a district nurse, a position we haven't until last school year when we were doing a job share with Junction City, had in our district for probably over 20 years. Another piece of good news to share is around donations. So for whatever reason, we've had multiple of these in the last few years. Started out maybe about 7 or 8 years ago. While there's lots of high school scholarships and even lots of local ones, I think of like the Brooke Wilberger Scholarship, her family, there's multiple, but probably about 7, 8 years ago, we had a gentleman, Gary Christian, graduate of Elmira High School. He really liked his high school science teacher then, who was by the name of Harold Plateau. He donated $10,000. And we've been giving the interest of that to our science student of the year each year in a little scholarship when they got their award. Well, he recently added another $100,000 to that amount. Now, with the larger amount, we've invested it with Oregon Community Foundation, and we earn around, kind of depends on the year, but there will be around $7,000 to $9,000 available each year in scholarships. Then about 2 years ago, 2 to 3, the Montgomery family reached out to me, to Gary Montgomery, to start a scholarship in honor of his mom and dad, Elnie and Velna. And they donated nearly $700,000, if I recall. I believe we issued our first scholarships last year. I think they were in the amount of either $4,000 or $5,000, and they're renewable each year. So that was great. Then a few months ago, Gary Swanson reached out to me on behalf of his family, and we're close to kind of finalizing a scholarship with them. And I believe their family is donating nearly $400,000. So that scholarship, it may or may not be in effect this scholarship cycle this spring, but it will get finalized hopefully in the next month or so. I hope to have Mr. Swanson attend our April board meeting, just like I had Gary Christian attend our last month's board meeting. So that's great. And then this last week, I got another phone call from a 1969 graduate of Elmira High School who currently lives in Arizona. And he's wanting to donate around $60,000 to create another recurring scholarship for students. So that definitely won't be in cycle this year. We got several months worth of work and agreements to come to and plans in place with Oregon Community Foundation. But again, just tremendous donations from these families that really supports, do a lot of good to a lot of Elmira High School graduates, and we're super thankful. So third good news to share is that today went well. Today was our first day with optional masking. In addition, parents had an opportunity, if they wanted, to walk their student to classroom or be a short-term visitor, as we would term it, before school and or after school if they wanted to go talk to their child's teacher. That's now allowable. I had kind of each building give me a report by the end of the day. It appears we probably have, well, 15 to 25% of our staff still wearing masks, which is great, and we support that. And probably 10 to 20% of our students still wearing masks, also great, and we will continue to support that. But the first day went well. I think kids were excited. I was at Elmira Elementary when they got started today, and the high school when they got started today. It was great to see lots of faces. And fortunately, we're in an environment right now where we can do that. So I just wanted to share that this morning went well. Thanks to all our staff that helped make it go well. All right. Next thing I wanted to do, just probably most of you that are on here are engaged enough and follow enough that you've seen these documents, but I'll share my screen. This, Miss Marshall, can you unmute and tell me if you can see that? Community level guidance, CDC or Mark or anyone?
I can see it.
Okay. So we put out this document on Friday, kind of been working on it for a few weeks to kind of take a massive amount of information and get it in something clean that is easily deciphered for folks. So this is what we've come up with. It's certainly a work in progress. Probably after this first week over spring break, we'll probably make some small tweaks or adjustments. But the general parameters, nothing significant, I don't expect to change. Kind of goes over each category. I'll just run down them real quick. The levels, which I'll show you how to find those on our website here in a minute, but are the CDC community levels of green, yellow, and red. 2 weeks ago on Friday, we were in red. A week ago, so 9-10 days ago, we dropped down to yellow, and then this last Friday on the 11th was the first time Lane County has been in green. So that nicely coincided with our changes that occurred on Monday. For us, the only time on campus now that masks are required is in what's termed a healthcare setting. It's really just our health rooms when students are in there or staff members in there exhibiting primary symptoms. It'll stay the same when it's in yellow. When we're in red, there may be, and this might be one adjustment in the weeks or months to come. Hopefully we don't go to red between now and the end of the school year. I think there probably is a high likelihood we won't. But if we do, there could be, obviously we'll take Lane County Public Health recommendations, follow our communicable disease plan, but there could be some additional areas we consider requiring masks. What would those be? Off the top of my head, possibly for staff supervising the lunchroom, possibly for choir. There's probably a few more, but just things that'll be in consideration when we're in red. Certainly will still remain optional the vast majority of the time in the day. Contact tracing, again, not required. If we're in red, we'll communicate with Lane County Public Health if they recommend any other changes. Same with quarantine. Testing, we have tests available. Anytime a family or a student needs one, just reach out. Building principal can help you, district nurse. You can come here to the district office as well. Social distancing, our goal is 3 feet to the extent possible. So we continue to try to practice social distancing of 3 feet. At the same time, we have activities where that is not possible occasionally. Vaccination requirements, that OAR has not changed, that stays the same. Cohort notification is required. And actually the term they might use is just strongly recommended, but we're doing that. So if, for example, 3rd grade student is sick in class, ends up testing positive, we'll notify that classroom if it's in elementary school. We'll typically do that via phone dialer. So if you feel like we don't have your most up-to-date phone dialer number, you could call your school and make sure you get that updated. We're also working with that system to, for example, if we put out a message on the phone dialer, have that same message available if it's short enough via text and email. So we're working with the vendor that helps with that system. And in a perfect world, we think we might even be able to upload the middle school and high school master schedule. So then we could take a student, let's say at the high school, and do a cohort notification to the 7 periods or classes that they have throughout the day, because the system will know what classes they're in, what students are in there. Phone dialer would just go out to those students. So those are some things in the works, but we will continue to do cohort notifications. The next thing I wanted to share was up at the top right of our webpage, we go to this tab, 21-22 school year, and we've added this little widget on the right. It's where you can enter your state. Here we are, Oregon. We can enter our county, and this will show you that green, yellow, orange table. And you can see that this last Friday we went to green, which is the first time we've been there. Let's see. I think that's all I had kind of in my usual first 10-minute overview or presentation of updates. So are there any questions? You can type them in the chat. Let me see if I can get out of my stop screen sharing. Stop share. There we go. You'd think I've been doing this for 2 years, but all right. Let me pull up the chat. Here we are. Any timelines on when volunteers will be able to be on campus during the school day? No hard timeline, but I do anticipate that this school year. We still are bound by OAR 333-019-1030, which says it really is about people volunteering for the school. So this idea that, we just changed the before school thing, short-term visitor, that was never a law. That was just strongly recommended. Limit to only critical volunteers, essential volunteers was the term they used. And we didn't really have any volunteer in our building that we couldn't operate without. While they're sure great and provide a lot of great services, we could still provide instruction without volunteers. The OARs, however, still says, for example, I have it pulled up right here. Teachers, school staff, and volunteers may not teach, work, learn, study, assist, observe at a school unless they're fully vaccinated or have documentation of a medical or religious exception, and the exception has been approved. So, our practice, not only for our volunteers, but our staff, back in October, when we made the decision to require our staff to be vaccinated, as this OAR states, and when we approved our folks that everyone that turned in a religious exception, we didn't have any medical exceptions, everyone that turned in a religious exception had it approved. Some folks, I believe we had 4, we were able to adjust their work schedule. They have duties outside of the school day that they were able to continue to work. Other folks that had direct contact with kids were not, and were offered unpaid leave. The environment we're in now is a lot different than it was in October. For example, now a vaccine is available for every school age kid, at least 5 to 12. We don't have the community spread. Their transmission is not near as high. There's not as many people in the hospital. And most importantly, one of the things that the law talks about is that we have to do things, let me find the exact words so I don't misspeak. Schools that grant a medical or religious exception to the vaccination requirement must take steps to ensure the unvaccinated teachers, school staff, or volunteers are protected. And there is no criteria, there is no metric for what's a reasonable step. What's a reasonable step to ensure that, in this example, like Maya's asking, a volunteer is protected from contracting and spreading COVID. The one thing that was clear in both conversations with ODE and our attorneys that they were giving to all the school districts in Oregon is it can't just be what you're doing for everybody else. So back in October, wearing a mask for a volunteer, that wasn't a reasonable step to ensure that I'm further protecting them. That was just what everyone is doing. Well, now we're in an environment where, for example, we could say volunteers, okay, based on current metrics, based on the fact that now vaccines are available, based on there is not as much community spread, and now wearing a mask is an extra protection that I'm requiring, there is a possibility, I think, that over the next few weeks, month plus, we could get there and come up with a standard. You know, what we don't have the capacity to do, for example, is let's say we had 100 folks that wanted to volunteer and 50 of them were vaccinated. So I think that's probably going to be the first group that I let in. At the same time, I'd like to try to let in unvaccinated as well, but we're just going to have to see. If we get there, what it will be probably is I'll have a standard template based on the type of volunteering you're doing. So for example, one thing we're working on and I've been thinking about is I'm an unvaccinated volunteer. I've submitted my religious exception. Okay, here's my standard boilerplate. I'm going on a field trip on the bus for an unvaccinated volunteer, or a standard in classroom agreement for these folks that would allow them to do it. And what could that include? That could include possibly, again, it's kind of two groups. Vaccinated, there won't really be any other requirements. But unvaccinated, there will be some document that to be in compliance with this law that we'll need to do. You know, up to this point, not having volunteers in our building, we could have had volunteers in our building all year long. It is just impossible to do in my mind, and protect the district, protect the liability that we're taking on without accepting medical or religious exceptions, and then coming up with a plan. They're going to get weekly tested. They're going to test that morning before they come in. They're going to wear a mask. They're going to wear a face shield. They're not going to work with medically fragile kids. They're not going to go in the health room. They're not going to be in the lunchroom, whatever these things are. So that was a long answer to Maya's question, but summary is I hope we get there. I think we'll get there. I think we'll get there before the end of this school year. We could start with just vaccinated folks, but I also believe we'll get there for the entire population, a plan or a course for anyone to be a volunteer, but they'll need to understand, they'll need to adhere to the protocols that we'll have in place for their plan to include some of those things like I just mentioned. So again, long answer, but hopefully I got to it. Good question. Anybody else have any questions for the day? Look real quick. Looks like our board meeting in April is on April 18th. So that's our next community Q&A will be 5:30 on April 18th, and the board meeting at 6:30. All right, not hearing or seeing any other questions, I will end the meeting. Thanks to those of you that attended. Appreciate you stopping by, and we'll see you next month. Thanks.